what do you see that are the top trends impacting rehab therapy?
Yeah, there's a lot of things that that are sort of impacting our trajectory. Obviously, there's been a consistent sort of decline in our revenue or our pay per visit, and so you know trying to figure out alternative ways to generate revenue or to get more patients in the door, right? And with that, unfortunately, that's been a struggle for us because we've talked about this for a long time, and there's a lot of folks in the industry still talking about this too. It's just the brand of PT and how unfortunately we haven't done a good job of really broadcasting that brand and our value that we provide in the overall healthcare continuum. And so I think the trend of really emphasizing and helping to unify our language around what we do as therapists to the general public, how do we better communicate that brand to others, I think is definitely something I really feel like there's a lot more people circulating and coming together to understand that this is a big issue that we need to solve. Over the last couple of years, with the pandemic and, people going home and it's the rise of virtual visits and telehealth, is definitely something that we're going to continue to need to figure out how physical therapy fits into that world. Personally, I think it's going to be the hybrid model that wins out. Uh, I don't think there's anything. Our secret sauce is about, what we do with our hands and how we put our hands on patients. But that doesn't have to mean that happens every visit. Our other part of what we do is exercise instruction and posture and, behavioral change. And those types of things don't always have to be done face to face. And so how do we evolve our practice into maybe this more virtual model, which again, we have to meet our patients, our customers, where they are. And, a lot has changed in the last couple of years and people aren't, their ways that they maneuver through the world today is a lot different. And a lot of it now has to do with this, through a computer.
Yes.
And we're seeing a lot of competitive pressure in this area. There's quite a few large organizations and companies, tech companies that are now coming into our space that are all virtual. So private equity knows that what we do is very beneficial, but it's how do you deliver that service in a way that people are willing to consume it and willing to take it, and maximize the value. And of course, insurance companies always want to maximize the cost, right? To minimize the cost, I should say. So those are some of the big things. I mean, from internal, we like many other industries are dealing with burnout. We were essential workers, so we are essential workers through this time, and it's been a tough road of change, and how we actually, the visit numbers going up and down, people changing jobs. Like there's a lot of different things going on with regard to burnout, but I still think we are still one of the number one healthcare providers in terms of people wanting to be a physical therapist. So I think that we're going to survive through all of this. And something I'm really personally invested in is as we think about the future of PT, is really diversifying our workforce and really helping to improve and mirror more of the population to hopefully be able to overcome and attack what we call the 90% problem, right? I'm sure you've heard of it, but so many more people are now starting to recognize that we're fighting over the same 10% of the US population that understands the value of PT and gets in to see us. So 90% of those people who have been diagnosed with an MSK diagnosis are not getting into PT. They're going elsewhere. And we need to really move the needle on getting more of those folks into PT. And so figuring out ways to do that, I think, are definitely big trends that we're going to see in the next few years.